And that was something I read on your website, was the statistics about how the 82% how people are, are wanting more of that, because they see that change in the behaviour within their practice of both obviously themselves and their patients. And something I just was curious, and this question's come into my mind a couple of times, as healthcare professionals, and there's that line between being, these might not be the right words, so please correct me, but be between friendly and familiar. Where's how that fine line? Could you, because obviously you're, as part of your process, people are getting more vulnerable and they're getting more information, which is what's helping them make better, themselves and their client make better choices. But obviously when that occurs, that extra opening up occurs, a deeper connection in relationship, this human connection would change as well. So how do they cope or manage that?
It's a very good question. If I become too friendly with my patient, this means that I haven't really done the right steps. I haven't really done the right approach. You need you come close enough, but in a professional way, every step of the way, is showing your patient or client that whatever we are discussing, we're discussing it for this reason. Right. So we're discussing it for this reason, and that's where you assert and affirm that you are a specialist in this, and I'm sort of proving it to you because you said this, and this means this to me. This is how it's going. This is how this piece of information is going to help you with managing your issue. But if it's just a social conversation that brings us close and whatever, that's not
the same.
You gain a friendly environment, but you're losing the professional part of it. Which is
Thank you for explaining that. Now, when you were explaining your methodology, I could feel that it was very much in that space, but I thought it would be interesting, and I wasn't going to be able to explain it. So I'm glad that I asked the question that enabled that to come out, because I could hear people going, yeah, but if you do this, it could, this over here could happen. But it's all about having that professional approach and outcomes driven, but just that it's more than empathy, but there's just it's that guiding approach and getting that information out to be able to create a better wholer environment for that diagnosis, etc. as well.